the photo. So, bibilang po ako, ha? Wait lang. Yung may gusto lang po mag-open ng kanilang camera. For privacy purposes. Okay. 1, 2, 3. Okay, another one po. Kasi dalawa po tayo dito sa screen. So again, 1, 2, 3. This one is already recorded so that Bishop Mercado will be able to see your faces together with all the bishops. No? Again, good morning to all of you, starting from Angel, we have Heidi, we have Patricia, Mary, Lian, Dr. Joy, Florencio, Carol, Nida, Paz. We have also Nelfa, Jonaline, and Mr. and Mrs. Cabuyo. Okay, no? So welcome to our teacher training course on the Billings ovulation method. Okay, so let's have a quick recap of what we studied last time before we proceed to the topic for today. No? Okay, so let's start. So take note that the Billings ovulation method is based on the 4 phases of the cycle. No? So there are 4 phases in the cycle. Let me enumerate the 4 phases of the cycle. The first one is known to be the menstrual bleeding, o tinatawag natin in Filipino, regla. During the days of menstruation, the woman will both feel and see the bleed as it arrives at the vulva. So it is very impossible for a woman not to recognize the bleeding. If there is a bleeding or a menstrual bleeding, take note, it can be sensed at the same time it can be seen as it arrives at the vulva. During the days of menstruation, the cervix is open. Take note of that. And because the cervix is open, it is a possible fertile period. There are occasions in the life of the woman that during the days of menstruation, there is also an ovulation. So menstruation, under the studies conducted by Drs. John and Evelyn Billings, menstrual bleeding is considered to be a fertile period. For those couples who would like to abstain from having to postpone pregnancy, they are asked to abstain from any genital contact during the days of menstruation. So menstruation, the first phase of the cycle. We can use a shaded circle for charting or color red. So the red color symbolizes menstrual bleeding, including the shaded circle. The sensation of menstruation must be wet. If the bleeding or the spotting is already dry, then that is no longer menstruation. I repeat, menstruation is a heavy flow, wherein the sensation by the vulva would be wet. The moment na mahina na ang menstruation or spotting, and the sensation of the spotting is dry, then it is no longer menstruation, but it is the beginning of a new phase in the cycle. So menstruation is heavy bleeding with a wet sensation. So take note of the symbols that we are using. No? So if there is no more bleeding and the sensation is already dry, it means the cervix is already closed. No more discharge. After menstruation, we have the second phase of the cycle, and we call it the basic infertile pattern, or BIP. That is the color green after the menstrual bleeding, the color red. So BIP means cervix is closed by the mucus plug, impenetrable, the sensation is dry, and BIP comes immediately after menstruation. So looking at the slide, it says, following menstruation, cervix occluded with thick, dense plug of mucus, and that mucus plug is impenetrable, and the sensation of the vulva is dry. During the days wherein the cervix is closed, during the days of BIP, the woman is considered to be infertile. Sperm cannot enter and sperm dies immediately if there will be sexual intercourse. So this is the BIP, which comes immediately next after menstruation. No? So looking at the color red, I want you to focus on the color red or the shaded circle. Wet, 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 sticky. These are the days of menstruation. But the next one, there is a dry spotting. The 4 dots there signify spotting. If the spotting is dry, it is no longer menstrual bleeding. It is the beginning of the BIP. So basic infertile pattern begins the moment there is already a sensation of dry after menstruation. So even though there will be spotting, it is no longer part of the menstrual bleeding. It is dry by sensation, spotting. It is considered to be a BIP or the basic infertile pattern of dry. There are 2 types of BIP. The one with color green. Green means dry or vertical line. Look at the symbols. The color yellow is also a BIP, but we will be discussing the yellow or the BIP of discharge next Saturday. We will only focus for today to the first type of BIP. Take note, the first type of BIP is the unchanging pattern of dry. You are totally dry after menstrual bleeding. So this is BIP. Please refer to our slide. During the days of BIP, look at the diagram at the right. Cervix is closed. Look at the color of the BIP. If you will be doing the charting, it is color green. And if you don't have a color, what would be the symbol that you can use? A vertical line. So take note of the sensation. The sensation is dry. So plug prevents the passage of sperm during the days of BIP. Not only the sperm, but it protects the body from any infection because the mucus plug is impenetrable. Bacteria and viruses cannot enter. Okay? Sperm cells kept out in vagina quickly become incapable of fertilizing ovum and destroyed by the surrounding cells. So the moment the sperm enter and the cervix is closed, because that is the days of the BIP, sperm dies immediately. No capability of penetrating inside the body of the woman because the mucus plug is there to prevent the passage of the sperm. Is that clear to all? So take note, what is the second phase of the cycle? The second phase is the BIP. BIP means basic infertile pattern. And we are discussing the unchanging pattern of dry. BIP of dry after mens. How long is the BIP? No one can tell. If the days of the BIP would be average of 7 to 9 days, then you have an average cycle. What is an average cycle? 1 menstrual bleeding in a cycle, in a 35-day cycle. But take note, if the BIP would be shorter, or if the BIP disappear, no BIP, then the cycle will be considered to be short cycle. It means you have 2 menstruation in a cycle, no? And then the BIP can also be extended. It can be long. It can be more than 9 days. It can be 2 weeks, 3 weeks, or a month. If the BIP would be very long, then the cycle is considered to be a long cycle. A long cycle, it means the days of the BIP is beyond 9 days. An average cycle, a short cycle, a long cycle, they are all considered to be normal pattern. Clear? So with this, we exit now the basic infertile pattern. No? By the way, during the BIP, no, the ovaries are quiescent, the cervix is closed, the vulva is dry, and there are no discharge that the woman would be able to spot in her underwear. No? So now, after the BIP comes the next part of the phase of the cycle. We call it the changing pattern of discharge. It is the beginning of the production of mucus or white mens. And when mucus is produced, mucus is changing. From a sticky sensation, it will become wet, it will become slippery. 3 stages: sticky, wet, slippery. We call it the changing pattern of discharge, changing, or the developing pattern of discharge. During the days wherein mucus is available, wherein the woman can sense it at the vulva and can see it there along the underwear, mucus signifies that the ovaries are active, meaning the follicles are awake. We discussed that last Saturday. It is also an indication that there is what? Increasing amount of estrogen happening in the body of the woman. During the days of menstruation, low estrogen. During the days of BIP, low estrogen. But the moment you see the presence of mucus, it means estrogen is beginning to rise, and it will continue to rise. So look at the slides. Ovaries are active and are producing estrogen during the days of the mucus secretion or production. Cervix is stimulated. Fluid mucus is produced. It will now dislodge the plug. It frees the plug. No more plug. Cervix is open, and sperm can now enter the cervix. Possible pregnancy. Clear? So take note of this one. Okay, now what is the symbol if you will be able to spot mucus? The symbol is circle. In the first world country, they are using the baby stump, no? But we don't have baby stump, no, in the Philippines, so we can use the circle. The circle signifies that there is already a mucus available. Look at the chart. The first appearance of mucus is cloudy, malabo. And the first sensation of the mucus is sticky. Why? Look at the diagram at the right. The plug is already dislodged. The moment the plug is dislodged, the woman will be able to feel the sudden drop of the plug in her underwear. At kapag yan ay bumagsak, akala niya sa una, it is a menstruation. But the moment she check it in her comfort room or sa public toilet, if she is in a mall or in a market, ang makikita niya is a cloudy mucus with a sticky sensation. It means the cervix is already open. It means the ovaries are active, follicles are awake. It means that there is an ER. ER means estrogen rise, not emergency room. The moment you see the mucus secretion, it is an indication that the estrogen is now rising in the body of the woman. But take note, no? Look at the mucus secretion. As I mentioned earlier, it is a changing pattern. It starts with a sticky. The moment the estrogen increases, the mucus will become clear wet. The moment the estrogen becomes higher, it will become slippery. There are 3 stages. If you will look at the development of the mucus, it starts with the sticky, it becomes wet, and mucus must end in a slippery sensation. Why? Why is there a need for us to be sure that mucus will end up in a slippery clear sensation? Let us look what Dr. Billings is telling us. According to Dr. Billings, mucus progressively changing into a sticky cloudy, it becomes wet, clear wet, and it ends with a slippery sensation. We call it the changing pattern of fertility or a developing pattern. And what is the importance of this one? The importance is this. The end of mucus must be slippery mucus. Slippery mucus indicates the egg is already mature and any moment there will be an ovulation. So the slippery mucus is an indicator of ovulation. It is an indicator that the egg reaches its maturity. If mucus will not end in slippery, there will be no ovulation because the egg did not reach its maturity. And if there will be no ovulation, then there will be no luteal phase, which I will explain later. But the most important right now for us to know would be this. The moment mucus starts to appear, mucus must undergo a developing pattern. Starting with a sticky cloudy, it becomes wet, clear, and it ends with a slippery sensation. Now you know the importance of the slippery sensation. It tells us that the egg is already mature and any moment there will be an ovulation. The last day of slippery sensation, we call it the peak day. Okay? So look at the slide. The last day of slippery sensation, it is known to be the peak day. So how to identify the peak day, the last day of slippery sensation? It is the last day if the following day you are already dry. Look at the slide. Sticky, wet, clear, slippery, 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 dry. Where is where is the last day? The last day is the day before it becomes dry. And we mark it with an X. So, let's go back. So we mark it with an X. X means peak day. To take note, peak day is not the last day of mucus. Take note of the adjective. It is the last day of the slippery sensation. This is the third phase of the cycle. The third phase is the changing pattern of fertility. Mucus developing and ending with a slippery sensation. There is a peak. Let us have a quick review. Menstruation, first part of the cycle. BIP, dry, second phase of the cycle. What is the third? The appearance of the mucus, and mucus changes. Take note of developing pattern, changes into clear and ending with the slippery. If mucus ends with the slippery, there is a peak, an X. There is also an ovulation. Then we call it the changing pattern of fertility. After that, we will now have what we call the luteal phase. The luteal phase is it starts at the first day after the peak day. So all the color green is considered to be the luteal phase. But the first 3 days of the luteal are considered to be fertile. Why? Because the cervix is still open. The cervix begins to close at the 4th day of the luteal phase or at the 4th day past the peak day. This is the luteal phase. How long is the luteal phase? 11 to 16 days. And after 11 to 16 days, menstruation now will commence again. That is why it is a cycle. Menstruation, BIP, the changing pattern of fertility leading to a peak, ending with a slippery, and then luteal. How long is the luteal? 11 to 16 days. After the luteal phase, what comes next? It will go back to the first part of the cycle, which is menstruation. So menstruation commences. Ang regla ay darating. Menstruation commences 11 to 16 days after the peak. Because after the peak, you have 11 to 16 days of luteal and then menstruation. I repeat, menstruation commences 11 to 16 days after the peak day. And again, what is the peak day? In Filipino, ito ang huling araw na ang mucus mo ay madulas. The last day of the slippery mucus is known to be the peak day. It is very important because it tells us that the egg is already mature and ready for ovulation. Okay, I want you to look now at the chart that you are seeing right now, no? Okay. Can you please tell me what are the days of menstrual bleeding? You can switch on your microphone and please tell me the dates, no? The number of days for menstruation. Okay, anybody from our class? Can you please tell me the number? For example, 1 until what day is? Yes?
1 to 5.
1 to 4. Okay, 1 to 4 would be the days of menstruation. Why 1 to 4? Because day 5 is already dry. Take note, ha? If the spotting is dry, it is no longer part of the menstrual bleeding. It is the beginning of the BIP. So BIP starts on day 5. Take note. So day 5. Until what day BIP will end? If BIP starts on day 5, BIP would be until what day? Can you please tell me? Switch on your microphone or you can place your answer in the chat box.
Day 10.
Day 10. Very good, Nida. Thank you so much for your answer. Day 10. So day 5 until day 10, the sensation is dry. BIP. And what can you say about the cervix? The cervix is closed during the days of 5 until 10. But the cervix is open during days 1 to 4. Very clear, no? Okay, let's continue. Now, where is the peak day? What day is the peak day?
Day 16.
Day 16. Thank you, Mr. and Mrs. Calbuyok. Day 16. Why? Because day 16 is the last day of the slippery sensation. So cervix is open during days 11 to 16, including 17, 18, 19. Take note, ha? The cervix begins to open again on day 11 until day 16, including the first 3 days of the luteal, 17, 18, 19. Cervix is completely closed on the 4th day of the luteal. And where is the 4th day of the luteal? Can you please tell me what day is that?
20. 20th.
20. Mary Joy Cubera, day 20. The cervix is already closed until day 30. Okay, so if we will try to look at the chart, day 1 to day 4, fertile, open cervix. Day 5 to day 10, infertile, cervix is closed. Day 11 until day 16, peak day, day of ovulation, including 17, 18, 19, the cervix is open, fertile, possible pregnancy. And again, the cervix begins to close on day 20 until day 30. Okay, can you please tell me how many days do we have for the luteal? Pakibilang nga yung days ng luteal. starting from 17 all the way to 30. How long is the luteal phase?
7, 8, 9, 10, 11, 12, 14.
So let's
14
start.
then.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So 14, according to John and Evelyn Billings, the luteal phase, how long? 11 to 16 days. So this is 14 days, so it means it is a normal luteal phase. It is within the what? Within the range. Ano ba yung range? 11 until 16. So after the 14th day of the luteal phase, menstruation now will commence on day 31. So meaning the cycle will go back again. So these are the 4 phases of the cycle. You have the menstruation, the BIP of dry, the changing pattern leading to slippery peak, and then you have the luteal phase.
Luteal
So
phase.
take note of the 4 phases. Do not anymore use the term pre-ovulatory, post-ovulatory, fertile period. Those are already what? Those are terms that are no longer applicable now that we are in the 21st or 22nd century, no? We use the correct terms. Menstruation, basic infertile pattern. Kapag nagkaroon ng mucus, we call it the changing pattern of fertility leading to peak. And then after that, you have the luteal phase. Okay, clear? So let's have another one. Okay, look at this. So menstruation, can you please tell me, where are the days of menstruation?
1 to 4.
Is it 1 to 4? Can you please
Day
check?
1 to 4.
1 to 5. No, menstruation, it has a sensation of wet. Thank you, Pas. And then BIP starts on day 6 and it ends on day 11. Day 6 to day 11, infertile. Cervix is completely what? Completely closed. Okay? But the changing pattern of fertility begins on day 12. It starts with an opaque appearance or cloudy and mabasa-masa, damp. It develops into a wet, clear, and it ends with a slippery. This is a normal pattern. Why? Because mucus starts with sticky or damp and it ends with a slippery sensation. The peak day is on day 18, the last day of the slippery mucus. Day 18, the egg is already mature and ovulation would be what? About to take place. The luteal phase begins on day 19 and it ends on day 30. But the cervix is open on day 12 until day 18, including 19, 20, and 21. 22, cervix is already completely closed at the 4th day past the peak or the 4th day of the luteal phase. So these are the complete cycle. Menstruation, the BIP, the changing pattern of fertility, and then the last one is the luteal phase. How long should be the luteal phase to be a normal pattern? It should be within the range of 11 to 16 days. So these are the phases of the cycle. Menstruation, the infertile period, or we call it the BIP, the changing pattern of fertility, including 1, 2, 3. These are the days of the fertile period wherein the cervix is open. And then we have now the 4th day of the luteal phase as the start of the infertility. No? But the luteal phase, take note, it begins on day 1 after the peak day. Take note, ha? Luteal phase begins on day 1 after the peak. But it is considered to be fertile because cervix will be totally closed on the 4th day after the peak day. So the Billings ovulation method, and these are the 4 phases of the cycle. Again, it always starts with the menstrual bleeding.